Oh, you got it. Thanks, Francisco. You started the recording. Okay, great. All right. Well, it is 8:17. We have lots of information to provide to you today. So I'm just going to give you a quick overview of the agenda, and then we'll hop right into it. So most of what we have to share today are actually a PowerPoint, attachments, spreadsheets. So you'll see on the side, topic 1, we're going to have a tutorial from Kathy on SmartCare procedural codes. Agenda item 2, we're going to show and share our crosswalk from Avatar to SmartCare. And then Jennifer, if you'll scroll down a little bit. Agenda item 3 is our individual and group provider crosswalk. And then the next agenda item is the full CalMesa crosswalk. So there are some additional codes that you could possibly use, and we'll talk about that. And then our agenda item 4 is our formula for you to be able to calculate how much to enter on your CMS 1500 form for your claims. So we have quite a full agenda, and we will share what we have to share and then stop to take questions and then go on to the next section. So I will turn it over to Kathy. She's going to start with agenda item 1, so a training on SmartCare. And then after her training, we will stop and show the agenda again and take questions. So thank you, Kathy. Take it away.
Thank you. And Jennifer, I am going to display a PowerPoint. So I will be sharing. If you could pull down the agenda. See. So hopefully you should all be able to see my screen.
I can see it.
All right. And good morning. My name is Catherine Rexroad. I am the clinical supervisor, one of 3 clinical supervisors here at the managed care office. I'm going to present to you a hopefully short tutorial on our new SmartCare procedure codes. The training in this meeting is being recorded. You will receive this PowerPoint following our meeting. And I will be taking questions at the end of the presentation. If you do have any questions, please feel free to enter them in the chat. And at the very end, we will field your questions. So without further ado, our tutorial on the new SmartCare procedure codes. And let me get this going. There we go. So, effective July 1st, the California Department of Health Care Services implemented new directives as part of the California Advancing and Innovating Medi-Cal, or CalAIM, payment reform. And for complete guidance, along with definitions, tables of the available CPT and HCPC codes associated with claiming, please refer to the DHCS Specialty Mental Health Services Medi-Cal Billing Manual version 1.4. So if you want a fuller explanation of any codes, this is the reference you would use. For ease of claim submission, the new SmartCare electronic health record adopted by Fresno County Department of Behavioral Health contains new SmartCare procedure codes that crosswalk to the CPT and HCPC codes that have been adopted by Medi-Cal. This crosswalk will be explained here, and for follow-up questions after this meeting, please contact the DBH Managed Care Office at mcare@fresnocountyca.gov. This tutorial was designed to be short. We are going to demonstrate the new SmartCare procedure codes using 2 of the most common claiming activities for our individual and group providers. That is the initial assessment and first individual psychotherapy session. And we're going to focus on using a paper-based CMS 1500 form. So let's start with that first assessment. It is Monday, July 3rd. I am an LMFT in a Fresno County mental health plan group provider practice, and I am about to see a new client for her first assessment appointment in my office. The assessment goes very well. I met with the client for over a full hour, 66 minutes, and it took me an additional 25 minutes to complete the assessment documentation. But how much actual time may I claim? Which service code or codes do I use, and do any of those modifiers apply to this service? So we're going to tackle that first question. How much actual time may I claim on my CMS 1500 form? All claims for outpatient services must use units of service. Only the time it takes to provide direct services associated with that procedure code can be counted towards a unit of service. Documentation time may not be claimed. So you've probably heard this phrase CPT. Again, CPT is current procedural terminology codes. They specify not only procedure, but the billing increment or a range of time, which is known as a unit. If no range is specified for a particular CPT code, direct service time must be at least 51% of a specific increment to claim. And I will be explaining that further in the coming slides. When we, as Fresno County, transmit claims to Medi-Cal for reimbursement, all units that we transmit of service must be in whole numbers or whole units of the service, or the service line will be denied. And all CPT codes have a maximum units that can be billed. This identifies the maximum units of service that may be included on a service line for each outpatient procedure within a 24-hour period. So if you go into the specialty mental health service billing manual, you will find this maximum units that can be billed for every code. Some have additional ways to claim time, and some services encounters transmitted to Medi-Cal for reimbursement need to be claimed with 2 procedure codes, the primary code and an add-on code to claim reimbursement for additional time. Yes, I know this is starting to sound very confusing. That's why we're going to make it easier for you. SmartCare procedure codes have been created. For ease of claim submission, the new SmartCare electronic health record adopted by Fresno County Department of Behavioral Health contains SmartCare procedure codes that will automatically crosswalk to the CPT and HCPC codes once entered into our system. For you, the MHP individual and group providers, claim submissions will continue with the CMS 1500 forms utilizing newly created SmartCare procedure codes. In addition, the MHP individual and group providers will continue to denote minutes in the column 24G, days or units, and SmartCare will convert to the appropriate CPT or HCPC unit for claiming. So this should make it easier. You don't have to always know what the unit is. It'll calculate it for us. So you will be receiving, after this meeting, we'll discuss this after the training a little more in depth, but you will receive the Avatar to SmartCare crosswalk for individual and group providers. And with the transition from Avatar to SmartCare, effective July 1st, 2023, in lieu of more complex CPT and HCPC codes, Fresno County will release or has released a set of new SmartCare procedure codes. For all services provided on or after July 1st, 2023, SmartCare procedure codes should be entered on your CMS 1500 forms. And again, for all service provided on or after July 1st. If you this month are submitting claims for June, please use the avatar codes. These codes should be used effective July 1st. And you'll notice that you will get a copy of this table. You will notice that the SmartCare procedure codes are all 2 digits, and that the name of the procedure in some instances may be different than the old name. And a good example is under psychologist, you used to see individual assessment 103. It has now crosswalked over to 79 psychiatric diagnostic evaluation. So we have prepared this crosswalk for you. You will be receiving a copy after this training. So, and also with the new payment reform, please be mindful that you now must reach a minimum claiming threshold in order to claim a service. So with CalAIM, please be mindful there are now minimum time thresholds for each service. So for example, if you were going to claim for individual assessment, that is now 79 psychiatric diagnostic evaluation. It bills every 15 minutes. A unit of claiming is 15 minutes. You must reach a minimum of 51% or 8 minutes in order to claim for this service. We will be providing you with a copy of this table. So for that assessment activity that I provided on July 3rd, the proper claiming time is the direct service time of 66 minutes. But which SmartCare procedure code or codes do I use? And do any of those modifiers apply to this service? As an LMFT, I would claim using the SmartCare procedure code 79, psychiatric diagnostic evaluation, 66 minutes. In SmartCare, this claim will be converted to the appropriate primary CPT code of 90791 of 1 unit and an add-on code of G2212 of 3 units for a total submitted claim of 60 minutes. As the provider did not reach the 51% threshold for the additional 15-minute unit of claiming, the additional 6 minutes are not reimbursed. That is how the claim will convert over in our SmartCare system. And again, note on the maximum allowable time claimed. First, I discussed the minimum threshold. Now you must also be mindful of a maximum allowable time claimed. All primary procedure codes and add-on codes also have a specific increment of time and must be claimed in whole units when we enter it into our system. This primary procedure code has a maximum units that can be billed of 1 to equal the first 15 minutes, and a subsequent add-on code captures the remaining time in 15-minute increments with a maximum of 14 units. It's a lot of math. As the combined maximum units that can be billed for an assessment activity is 15 units, the maximum reimbursable time for any assessment activity is 225 minutes per 24-hour period. So I'm just bringing this up to make you aware you have a minimum threshold for assessment of 8 minutes. You may not bill less than 8 minutes for assessment. And in any given day, you may not bill more than 225 minutes within a 24-hour period. Can you bill assessment activity across multiple days? Yes, you may. So you can bill for 2 or 3 assessment appointments depending on how complex your assessment is. But for any given 24-hour period, the maximum here would be 225 minutes. Now, the question is, what would this look like on my CMS 1500 form? Because there was a lot of complex information I just gave you. And the good news is, with the SmartCare procedure code, you're still just looking at a one-line claim. So in this case, on your assessment activity, you'd still have the date range of 7/3/23, 7/3/23 for start and end, and your place of service still remains 11 office. But now you're going to use the SmartCare code under procedure code in 24D, which is 79. You're only going to use one line. You don't have to, no additional add-on codes are needed because SmartCare will do that for you. The actual direct service time in minutes is entered in column 24G for units. So you'll see I entered 66. And then the charges equal the 4 CPT units or 60 minutes allowed. You're probably thinking to yourself, how the heck, Kathy, did you calculate that? That is 4 units at the rate of an LPHA on your fee schedule. Later during this meeting, Marcy will be presenting an actual fee schedule and range that will help you calculate the charges. Please note, for this assessment activity, no modifier is needed. So I am done with this claim. So what if I did not render the assessment activity on July 3rd? My registered associate, who is credentialed with Fresno County, did. What if the client did not come into the office, but instead the assessment was conducted via telehealth, interactive audio video? Which SmartCare procedure codes or codes would I use, and do any of those modifiers apply to this service? Now the answer is yes. Modifiers provide a way to report or indicate that a service or procedure that has been performed has been modified by some specific circumstance, but not changed in its definition. Modifiers will not impact how a service is reimbursed, but may impact how a service should be billed and or who pays for the service. So in this case, because it was my registered associate and it was done via telehealth, I am going to add modifiers. And in this case, anytime an associate provides a service, you will use the HL modifier. That means intern. So in DHCS land, registered associates are known as interns. And because this was done outside of my office in via telehealth, I will be using a modifier to indicate the telehealth service. So again, it's still going to be one line on my CMS 1500 form, but now I'm adding the HL modifier to indicate the associate was the rendering provider. 95 modifier indicates telehealth. I have adjusted the charges to the unlicensed provider rate, and the AMFT uses their own NPI number. Very important, when you're using the telehealth modifiers, you also must be conscious of the place of service codes. If you're going to use the telehealth modifier 93 or 95, the place of service code must be 02 or 09, indicating that the client is either in their home or outside of their home, but not in your office. Those place of service codes are critical to ensure that the modifier and the claim are entered into our system smoothly. Now, it's a week later. It's now Monday, July 10th, 2023, and the person served is returning to my office for her first individual therapy session. The session goes very well. as a therapist certified in EMDR, and because it met the significant needs of my client, I conducted the first EMDR session, which lasted 84 minutes, and it took me an additional 11 minutes to complete the progress note documentation. But again, how much actual time may I claim, and which SmartCare procedure code or codes do I use, and do any of those modifiers apply to this service? So again, a reminder, all claims for outpatient services must use units of service, and only the time it takes to provide direct services associated with the procedure code can be counted towards the unit of service. Documentation time may not be claimed. And though the CPT coding for psychotherapy has 3 distinct procedure codes based on units of time, the SmartCare procedure code is simply 93, psychotherapy with patient. SmartCare will crosswalk all 93 psychotherapy with patient service claims to the appropriate CPT code set dependent on the time claimed. So in this case, when we're talking about individual psychotherapy, and this is probably the most common service that our individual providers utilize, psychotherapy, as far as the CPT code, has 3 distinct CPT codes based on the unit of service, meaning time. There's a 30-minute, a 45-minute, a 60-minute. You as the provider must use the total unit time. So you must use at least 30 minutes to claim before you can move on to the next level. So must use total unit time plus 51% of the difference between the levels of service code to claim the next level of service, i.e. 30 minutes plus at least 8 additional minutes to claim the 90834 psychotherapy, 45 minutes with patient. So you'll see on this slide, we have included the time range in the arrows to help you understand when you can move to the next unit of claiming. And only the last unit, the last CPT code, 90837 psychotherapy, 60 minutes, may be combined with the add-on code of G2212 for the additional 15-minute units of time. So yes, again, this is a lot of claiming to worry about. However, with the SmartCare procedure codes, all needed conversions to CPT coding will be done automatically in SmartCare. Only one service line is necessary on your CMS 1500 form. That slide makes me smile because we've just made something a little more simple for you. So, what would this look like on a CMS 1500 form? On the CMS 1500 claim form, the 84-minute individual therapy session is added on line 2. So what you'll see is I use the 93 SmartCare code. I entered the units of 84 minutes. And then you'll notice, if anybody is quick with their math, that the charges are $180.90. How did I do that? Charges equal conversion rate of 1 unit of 90837 and 2 units of G2212. So what does that equal? That equals 90 minutes of the full CPT code plus 15 full minutes in full units, plus 9 minutes that allowed for the additional unit of claiming as I passed the 51% of the 15-minute additional add-on claim. So that $180.90 actually equals a 90-minute paid session, even though I am only claiming 84 minutes. So again, we're going to explain that calculation a little more in an upcoming document, and we are going to provide you with that guidance so that you don't have to worry about all of this calculation. We have done it for you, and we will be providing you that table. So we have claimed both of our services, and I thought I was going to be done with my training, except we had one more thing we wanted to request of you, and that is the pregnancy indicator. Effective July 1st, the Department of Healthcare Services published a new perinatal practice guidelines as part of the California's efforts to improve the delivery of prevention and family services. As part of the new perinatal practice guidelines, if a person served is currently pregnant within 12 months of postpartum or within 12 months of post-termination, the MHP provider should include the condition on the client's problem list in the client's medical record using Z34.90, encounter for supervision of normal pregnancies, unspecified trimester, and it does crosswalk to a SNOMED code to identify the client's condition. All you're doing is identifying a client's condition along with their mental health condition. As part of the claiming process, in addition to adding the appropriate Z34.90 to the problem list in the medical record, on the regularly submitted CMS 1500 form in section 21, diagnosis or nature of illness or injury, in addition to the diagnosed mental health condition that supports your service claim, please always include 034.90 as part of the claim when your client fits these characteristics. This information will be added to the client profile in the county SmartCare system, along with the claimed services for tracking purposes only, and will have no effect on the actual claim reimbursement. It is meant for tracking purposes only. And so we do appreciate your cooperation with the pregnancy indicator. Finally, this tutorial was only focused on a very limited set of services, assessment and individual therapy, using the CMS 1500 form. We do strongly encourage you, if you have not already gone to the Cal Mesa website, we recommend you still do. We are going to be focusing on the SmartCare procedural codes, but to really understand them, you do have to understand CPT coding, and you will find a great tutorial, CPT Coding 101, on the Cal Mesa website. And the CPT Coding 102. We do recommend that you take both of those trainings. They are 1 hour each. And for complete guidance, along with definitions of tables from CPT and HCPC, DHCS has published that Specialty Mental Health Service Medi-Cal Billing Manual. We recommend that you download a copy because it can be very informative in how to work with the new codes. And if you visit the Fresno County Department of Behavioral Health CalAIM webpage, we will have specific resources, trainings, and news specific to our county. And again, after this meeting, if you have any questions about CalAIM implementation, please contact the DBH Compliance office at dbhcompliance@fresnocounty.gov. And with that, we are now going to open it up for questions. And I don't see any questions in the chat, but Tony, your hand is up. Good morning,
Yeah.
Tony.
Can just 1 second, because I want Jennifer to be able to capture the questions. So if it's okay,
Sure.
let's take the PowerPoint down and share the agenda so we can make sure we capture all of our questions to send out. So, okay, sorry, go ahead. And I think, go ahead, Kathy. I think you called on someone specifically.
Tony had his hand up first.
Yes. What is the code?
And Tony, you're going to have to speak up. We can't really hear you.
I see. How about now?
Yes.
I was wondering, what is the code if we are providing a service to the patient and the patient is in their home and it's being done by either telehealth or phone?
If the patient is at home,
Yes, and they're doing a telehealth individual, what would be the location code?
I am going to look that up because that information is in the Medi-Cal billing manual. It will take us a minute to pull that up. And
Okay, no
then
worries.
I will
I'll just
provide,
look it up.
it's going to be either 10 or 02. Those are the place of service codes. It's just that one indicates that the person is at home and the other one indicates they are not in your office and not at home. So it's going to be either 02 or 10.
So,
And the place of service codes are in the billing manual.
All right,
So-
Kathy, thank you so much.
Kathy, my question is actually related to that as well. So I wanted to throw it in while you were looking for things.
Good morning, Curtis.
Good morning, Kathy. So I received a spreadsheet yesterday that had location codes, and I noted on it that location codes changed. And so that's why I was a little curious, is because like you had mentioned 02 and 10, and in this spreadsheet that I got, telehealth, telephone audio only, client home is 03, telephone audio only, not in home is 02. So even like the group home changed from 14 to 16. So I was trying to get some clarification as if this is the new set of codes that we're supposed to be using, or if it still goes back to the old location codes.
I am looking at, whoops, no, I wasn't. I was looking at my place of service codes. Here we go. So the place of service codes that I am looking at is on page 45, starts on page 45 of the Specialty Mental Health Service Billing Manual. And you are correct. Let's see. 02 is telehealth provided other than in the patient's home. So that is 02. 03 is school, and place of service code 10 is telehealth provided in patient's home. So when you're using the place of service 10, that means the patient is sitting in their home and you're sitting elsewhere providing telehealth. 02 is telehealth provided other than the patient's home. The patient might be sitting at school or grandma's house when they're receiving the service. So
Okay.
I don't know if there was a change, but I am reading directly from the billing manual that says 02 is a place other than the patient's home. 10 is telehealth provided in the patient's home.
Okay, so the document that I'm referencing is the Batch Service Global Code Reference Guide that was sent out by Tegan yesterday.
Okay. We will double check that spreadsheet that you received yesterday. I am pulling my information from the DHCS billing manual.
I'm checking to see if Tegan is on the call right now or any of Tegan's
She's
colleagues.
not, but this is Joseph. So what she sent out yesterday would have been for org providers, right? So, and you mentioned Curtis batch file upload.
Yeah, I did, but I
Yeah,
mean,
this
would
group right
location
here.
codes be the same regardless, though, if they're going into SmartCare? That's where I was confused.
Yes.
And
Yeah. So for this group, Marcy and Kathy, these are individual and group providers, correct? So
Correct.
Yes.
it's going to be it's not a batch file upload, correct?
No.
Yeah.
But the place of service code would be the same whether you're using the CMS 1500 form for an individual group provider or the flat file for the large organizational providers. The place of service code would be the same across the board, that code set. And by the way, Curtis, the group home place of service code is 14.
No, yes, I'm aware that's what I've been billing to for years, but when I looked at the new sheet yesterday, it said 16. So that's why I was trying to get some clarification on all of the location codes.
We will double check that spreadsheet. We will definitely double check.
The distinction is, we were just talking about this yesterday. So for the claim submittals for org providers, the majority of them will be the, what do we call that? The batch file upload, right? But for individual folks like here, Marcy or Kathy, correct me if I'm wrong, those would be direct service entry. Is that correct? Individual.
We will, managed care will be directly entering the services based on the CMS 1500 forms submitted to us.
So it's not a batch file upload?
No.
Okay.
No.
Thank you.
But Curtis, we will double check the code set that was sent out.
Thank you.
All righty. And then Tony, did you have another question? Your hand is still up.
No question. I think I'm...
All right, thank you. And then from our chat, Melissa asked, will we get a list of rates?
Yes, we will. Actually, that's part of our presentation today. And I see Sean is on here as well. So that's actually information that we intend to share with you today to help you calculate what amount you should put on your CMS 1500 claim forms.
And keep in mind that we've already distributed a list of rates per type of provider with this contract. And if you need that list of the fee schedule for type of provider, we can resend that out. And then we also have a different list of rates as far as calculating the units. And Melissa, I hope we answered your question. I believe so. Okay. If not, please let us know. Rohina, question. It would be really helpful to cover CMS 1500 for collateral and group services, please. We agree, and we will be providing these office hours every other week, and tackling different services and different information each week. And but yeah, those are also very important services that we will be covering in the future.
And that's something we actually, just as of yesterday, are still working on and developing in terms of the collateral. So please look for more information to come on that. So I think, Jennifer, if you want to add under questions, a request for additional information on collateral and group, just so we have it documented and we already know that we are working on that and that will be provided.
And then Rohina had the next question. Can we include units on 24G on the CMS 1500 instead of minutes? No, please always use minutes on the units for 24G. We need to have consistency as far as taking your CMS 1500 forms and then entering them into our system to convert. And we will also, during a medical records audit, we would also be looking to see if the units of claiming of direct service time that you entered in G or 24G match the direct service minutes claimed on your progress note. So you still have to on your progress notes include direct service time, documentation time, and travel time. Even though you are not being directly reimbursed for documentation and travel, you still need to include those on your progress notes. And then when we do a compliance audit, we compare the minutes claimed on your CMS 1500 form to the minutes of direct service on your progress notes. So that's why it's so important to put the minutes on the CMS 1500 form.
Yeah, because Rohina, if you put in the units, it's going to short you, right? Because what's happening on the back end is SmartCare is taking the minutes that you give us and converting them into the units. So if you tell us it was 3 units of something, then you're actually going to get paid $0 because 3 minutes is not going to meet the threshold for any type of claiming. So please always use the full minutes so that SmartCare can correctly convert your minutes to the correct CPT codes. And one other thing to document, Jennifer, is under questions, can you also put validation of place of service codes? Because it sounds like there might be, we need to look at the place of service and validate that the information that was sent out to at least Curtis, it might have gone out to the org providers, but not the individual and group. So
yes,
we will
I'm going to
validate.
move along. I'm going to move along because we're going to run out of time. We have 15 minutes left, I think. Will the link to the billing manual be sent with this training PowerPoint? Yes,
Yeah.
it's in the PowerPoint. And we will add the link to the email.
And it is in every set of notes that we've sent out since we started office hours with individual and group providers. So the link to the billing manual is everywhere. It's on the CalAIM website. It's everywhere.
But we will get it to you. If the patient has CalViva, Medi-Cal, Anthem Blue Cross, Medi-Cal, do we bill their state of California, Fresno County Medi-Cal card? If you have Serena, are you asking, are you claiming to the managed care plans, Anthem Blue Cross and CalViva? Are you claiming to Fresno County MHP?
I'm sorry, repeat that.
Who are you claiming to, Serena? Are you claiming to CalViva or Anthem Blue Cross, which are the managed care plans?
Yes.
Or are you claiming to, okay, if you are, you claim to only one system in Medi-Cal. So you would either claim to the managed care plan, which would be CalViva or an Anthem Blue Cross, if it's a mild to moderate condition, or if it meets the eligibility for Medi-Cal, which is, we can cover eligibility in another training, you would then be billing to the managed care plan, Fresno County. So you would bill to one or the other, either the managed care plan or Fresno County.
Okay. I think that answered my question. Thank you.
Okay. And then Elizabeth says the location code should be the same. We will review the code sets. Thank you, Elizabeth. And Rohina, if we enter minutes on 24G on the CMS 1500, do we need to calculate based on units? We're gonna go to the fee schedule in just a moment. Hopefully, Rohina, that will answer your question about how to calculate based on units. And Melissa says, yes, thank you. We answered your question. So with that, thank you very much. Tony, you had a question?
Yes, so if we call a patient on the telephone and just to check in on, and the telephone is 10 minutes long, would that be something we bill for?
You would first always identify what the purpose of the contact was. So, are you providing case management? Are you providing individual therapy? Most frequently with these codes, you must meet that minimum threshold of 8 minutes. So a 10-minute phone call would potentially be claimable. It also is dependent on what intervention you provided. So yes, in a nutshell, a 10-minute phone call for the purpose of providing a procedure would be claimable.
And that would be under the 15-minute increment.
It depends. It depends on the type of procedure you provided.
I see.
So
all right.
It depends on what procedure you provided. Marcy, I'm going to turn it.
Question. So the question was, would a 10-minute phone call be claimable? Basically, right, Tony? That was the question. Would a 10-minute phone call be claimable? And
yes.
the answer is, if it is a claimable procedure and it meets the threshold for billing, then yes, it would be a claimable service.
All right, thank you.
And we'll talk about the thresholds because there are it's that 51% threshold. And then I know we're gonna end up going over on time. Sean, are you able to stay on to talk about the fees? We can actually skip to that last agenda item first, and we'll go backwards.
Fine. I can stay on.
You can stay on. Okay.
Yeah.
So Rohina, I see your hand up.
Thank you. I just wanted to clarify, was the answer to the question, yes, if we enter minutes on the 1500, then we need to calculate based on units, correct?
Yes.
Thank you.
Well, you're going to calculate, and that's what Sean is going to be explaining to you.
Yeah, there we go. That will make it easier. All right, so let's move on to agenda item 2. If you can scroll down, we're going to give you a quick preview, and everything that we're showing you today is going to be sent to you in an email. And the recording will be too large to send out in an email, but we will post it on our CalAIM website so that you can find it easily. So the recording will be available to you. So I am going to share the basic avatar to SmartCare crosswalk. I have a lot of things open, so I'm trying to figure out which one to share. So here is your basic crosswalk. So this is all of the services that used to be provided under our old agreement that was spelled out. Here's the services that you can provide. Trying to get it to where I can see my scroll bar. So here's our old codes in SmartCare. So you can see on this side, there's the old descriptors and old avatar codes all on the left-hand side. And then what you will see here are now all of your common claiming codes, all of the codes that you used to claim. Here are the new codes. So we will send this out to you so that it's an easy crosswalk for you. So one thing we wanted to point out that collateral is no longer a separate service that someone would provide. Collateral is actually billed with the intervention that's most closely associated with uh, the type of intervention that you provided. And so we will be providing, as we discussed earlier, we are going to be providing subsequent information on collateral and case management. Those are some things we've been talking about in our own, just as of yesterday, as a matter of fact, developing some more guidance for the entire system of care, both internally and externally, because this is the not having a collateral code to change and rolling it up into the type of intervention that is most closely associated with your collateral contact is a new concept for everyone that we are still working on providing additional detail. So you can see here that there is no code any longer. There's no CPT or HCPCS code for collateral specifically. So let me stop sharing that. And then I want to go ahead and skip to agenda item 4 because I know Sean worked late. My hat is off to Sean because he sent me this at midnight last night to make sure it was ready for everybody this morning. So I just want to give a big shout out to Sean for making sure that this was ready to go. Do you want to show it, Sean, or do you want me to show it? Because I have it open. It's
If you
up
have
to
it up,
you.
that's fine. Yeah, if you want
Yeah. I have a lot of things up, so let me make sure I share the right. So Sean's going to help us understand on your 1500 form, how do I calculate the amount that I should be entering for my claim? Let me just get to sharing the right document. With the formulas. Okay, that's the one I want. All right, so you can see that our finance department took our most commonly used codes, our crosswalk, and then I will scroll over, Sean, and let you do the talking part. And then
Sure. Actually, I think maybe the second tab might be helpful, based on Kathy's amazing presentation this morning. I think she described this perfectly. So really, you're trying to come up with, based on your minutes, your whole units, and then trying to figure out exactly how much you'll be paid based on that. So to get that, you need to look at your number of minutes paid by SmartCare code. Remember, you're going to give us those SmartCare procedure codes. And if you just look at the first one, for example, it's a 50-minute procedure code. So 1 unit is 50 minutes. So if you put anywhere between 25 and 74 minutes, that equals 1 50-minute procedure code whole unit. So really to get to the amount, it's pretty easy. We're just going to take your per minute rate and multiply it by 50. You need to know how much each procedure code is worth. So this is exactly how it rolls up. You see 73 rolls to different CPTs based on the number of minutes. So if you did 45 minutes, it would roll to the 99215 CPT. That's all in the background. You don't need to calculate any of that, but it would give you 1 whole unit of 47 minutes. So you take your per minute rate and multiply it by 47. So like a licensed clinician, I believe, is 201. So you just take 2.01 times 47, and that would give you your total minutes. If you had, let's say you were doing the 79 that Kathy described earlier, the psychiatric diagnostic evaluation, and she described having 4 units. That's pretty easy. You're just taking that 15 times 4 is 60, and then multiplying that by the per minute rate of 201, and that brings you to your basically an hour that you would be paid for that. Even if you did 66 minutes, that rounds to 4 whole units, which is 60 minutes. So Kathy made this a lot easier for me this morning because she did such a great job describing and then showing those flow charts. I think and I hope that supports everybody and kind of gives you what you need to calculate this. But I think maybe questions, if there's any questions, we can go over those.
I'll quickly show the fee
Yeah.
schedule tab really quick, and then I'll stop sharing so that we can document the questions. So Sean's team worked really hard on these other columns here. So amounts paid by 15-minute codes, amount paid by 30 minutes, and amount paid by 50 minutes if my scroll bar will cooperate with me. Sorry, guys, if I'm making you nauseous. My scroll bar is not cooperating with me. There we go.
So hopefully that's helpful. The only thing you need to be aware of is if there are codes that are not necessarily rolling to a 15, 30, or 50-minute. There are some other minutes with some whole units. You just need to be aware using that billing manual what one whole unit is equivalent to, and then that's how you would come up to that. And then you're rounding again to that closest to the whole unit. So if you're trying to identify the nearest the minutes to a 15-minute unit, it's you're dividing that by 2, your 15 minutes by 2, and anything less than half, of course, is nothing. More than half would round up. You're going to add 7 would round down, 8 would round up. So you could see there 15 plus 8, 23 would round to 2 units. So hopefully not too complicated, but those are how you would round and where you would identify where those whole units would land based on your units. And again, the final calculation is actually done in SmartCare. So you don't have to worry about all those different CPT codes and everything like Kathy said. You're just going to do that one line.
And Jennifer, if you want to put the notes back up so we can document questions. Let's see. I see somebody. Oh, Tony, you have your hand up.
Yes, so Sean, thank you for that explanation. I'm wondering, would I be able to link with you individually or come in and go over a claim form example so that I understand the calculations correctly?
Sean, you're on mute.
Sorry, my microphone has been weird all week. Thank you. We could, yeah, I want to make sure that we document for everybody. So if do you have specific questions we can address now, or are you looking for kind of that detail like what Marcy showed on the screen, or what would be beneficial?
So if I can maybe give you an example very quickly and see what calculations would come up, because I understand that in the claim form, the 1500 claim form, there's a section where we add the total that we are billing, right? And so in order to add the accurate calculation, let's say, for example, I see a patient for 55 minutes, a minor, a child, individual therapy. So that's 55 minutes of individual therapy. And then I meet with a mother after the individual session. And, mother's asking for, parenting strategies on what to do when the minor is displaying anger. And that session takes about, let's say, 43 minutes. So what would that look like as far as calculation of billing time? What would I need to put on the claim form?
So I'm glad we're asking this in the group, because this is a multi-division response here. So Kathy might actually be able to, or Marcy, be able to tell you exactly which lines you would claim that too better than I could.
So let's capture the question accurately. So I just want, just for documentation purposes, and like Sean said, this is a multi-division meeting. So Tony, your question was, you're providing family therapy and it's 43 minutes. Is that correct? Like, and then how do I calculate what the amount would be for my 1500 claim form?
So it would start off with 55 minutes of individual therapy with a minor.
Oh,
And then
okay.
after the individual therapy, mother wants to meet with me for like a parenting family session. The child is present. She's talking about anger and how to address the anger, and I give her some techniques. And that second meeting takes 43 minutes. What
Okay.
previously would be collateral.
Marcy, would you like to take this or would you like me to?
Go ahead if you feel comfortable, or if you want me to. I'm fine
Sure.
either.
So, in the coming weeks, we will talk a little more about what I call collateral engagement, meaning collateral itself is no longer an activity, but collateral engagements, when you're dealing with significant support persons, can still be claimed, but you would claim it depending on the actual procedure that you are engaged with. And so from your brief scenario, it sounds like you would need 2 claim lines. It sounds like the first procedure you provided was individual therapy with the client, 55 minutes. The second, actually, 45 minutes is pretty significant. Good for you. That sounds more like psychosocial rehabilitation, when you're providing the child and then the mom strategies for dealing with angry outbursts. And mom, what do I do when he has a temper tantrum? That sounds to me on the surface as a psychosocial rehabilitation. And so that's how I would claim it, is 2 different services. And you're being very clear. And that would actually be 2 different progress notes as well, because you actually did 2 different things, 2 different procedures. So on the surface, that would be my recommendation, how you would claim that scenario that you provided.
Yeah,
I'm sorry,
agreed.
Kathy. Can you repeat that word? It was psychosocial
rehabilitation. And by the way, looking at that, the individual the individual therapy session you have with the youth, you would claim 55 minutes on the CMS 1500 form, and that would transition over to 4 units in our CPT coding, or 60 minutes. And then psychosocial rehabilitation, you're going to claim 43 minutes on the CMS 1500 form. That is going to convert over to 3 units of psychosocial rehab, and then the unit of claiming for the fee would be 45 minutes. So that's how it would transition over to that CMS 1500 form. I'm done.
Thank you.
You're
You're
welcome.
perfect, Kathy. That's where. So thank you for appropriately identifying the descriptions, because I would not have known which one to claim that to. But yes, so the first one, 4 units at 15 minutes a unit, so 60 minutes, and the second one, 3 units at 15 minutes, so 45 minutes. And you would just take each line and do that per minute rate multiplied by the total number of whole unit minutes. So first line would be times 60, second line would be times 45. Perfect.
And I want to say, and it also sounds like you're providing great care to that family.
And before we send out the notes, we'll send them to Kathy so we can add the actual, Jennifer's capturing the general information, and we can clean them up and add it so that it's exactly very clear. Let's see, are there other hands up? Who else?
We had a question in the chat.
All right, I'm trying to see what's the last question? Oh.
The last one was Rohina. For family psychotherapy, do we not use the prolonged code of G2212? For example, if we provided 58 minutes of family psychotherapy, wouldn't it be 1 unit of 90847 and 1 unit of G2212?
So that's correct, Rohina, but all you would need to do is put in the SmartCare procedural code with 58 minutes, and then in SmartCare will take that procedural code and do exactly what you said. The SmartCare will convert it to the 90847 and then the add-on code of the G2212. So you just need to put in the SmartCare code and the minutes, and SmartCare does the conversion to the correct CPT or HCPC code in the background, and that's for all services.
I'm sorry. I think based on what Sean was just saying a few minutes ago, that particular code is a range and not the 15-minute increment. So I just wanted to clarify that was between 26 and 74 and not use of a prolonged code of the G2212.
So you're referring to SmartCare procedure code 34, family psychotherapy, patient present. It's a 50-minute code. You are going to input your minutes, and anything that you input between 25 and 74 will automatically calculate as one 50-minute unit.
So does that make sense? So there's that range, it'll calculate as 50 minutes, but in your example, Rohina, you have 58 minutes, and so it will add that additional G22.12 because you're past that range of the 70, the high end is 74. Did that answer your question, Rohina?
Yeah, I think what I'm hearing you guys say is that the 58 minutes doesn't involve the G22, that would just be a second. If you go over 75 minutes, there would be a second unit of family psychotherapy and not the prolonged code. That's what I'm trying to clarify.
Okay, Rohina, for 90847, this is an interesting one because the unit of claiming is 50 minutes. So in order to bill for the next add-on code, you must meet the full length of 15 minutes plus 51% of that primary code, or you're going to have to hit 26 minutes additional before we can add on anything else. So that's why the range for family psychotherapy is so wide, is because you have to hit the 51% mark of the primary code. So that's why you're seeing the 74 minutes.
But Kathy,
isn't that in our other document that we were going to show, Kathy? I think it's in there. Let me show another document because we were trying to demonstrate the thresholds. So
yes.
Let me pull up that document because that was another piece of information that we were going to show, which I thought, oh, I do have it open. It's PDF. That's why. Okay. So this, I think, will help with the question. So in your old SmartCare, in the old codes that you used to use for SmartCare, there were, you used to be able to bill for like a 5-minute individual psychotherapy session, which I can't imagine that happening, but it could be. You could bill for 5 minutes. Now the minimum is 16 minutes if you're looking at psychotherapy with the patient. That's the minimum. So that's the halfway point. So this document that we're going to send out to everybody is giving you the new minimum threshold. And so we're talking about group. Is that on here? Do we put group on here, Kathy? 60.
I think what you're looking for is the 83 family therapy that is now 34 family psychotherapy.
Here it is.
So right there.
So I think for the family psychotherapy, if I understand it correctly, you would build, let's say you build 50, 60, 70. If you build 70, 26 minutes is the absolute minimum. So let's say you hit your 50 minutes and then you add on another 27 minutes, you're going to bill another, it's going to convert to another CPT code for family psychotherapy. If I'm understanding correctly, it's not one of the CPT codes that the G2212, if I got it correct.
At 76 minutes, we could then add on the G2212 of the additional 15 minutes. But this is a good example of, the majority of CPT codes, the unit of claiming is 15 minutes, but that doesn't mean all CPT codes have a unit of 15 minutes. And so that's why we have this table with minimum thresholds. You'll see that there are a handful, just a few, like individual psychotherapy, where, your minimum threshold is 16 because the lowest claimable psychotherapy is 30 minutes. So it's just a good example of, not all CPT codes were created equal, and that's why the minimum thresholds vary in some instances.
Did that help answer your question, Rohina?
I'm a little confused because I thought the G2212 was only 15-minute increments, but I think I'm hearing you, Kathy, say that it could be a prolonged code regardless of the duration, so that it could also be the 50-minute or the 26-minute one for something that's not 50 minutes. So looking forward to the next training to clarify that.
Sure. Yeah. And we'll go back and double check it too. We're only actually 2 steps ahead of all of you. We're learning it and then we're sharing it. So we do sometimes will need to ask for grace, and we will double check.
Let's see. Dr. House, do you have your hand up?
Yes, I do. Can you hear me okay?
Yes.
Okay, good. So for physician or prescriber services, for the CPT codes, they fall under evaluation and management codes. And on those, we have the choice of time or medical decision making. So if we go ahead and document and see a patient and code based on medical decision making, do we still need to, and we document that that's the reason we coded for that. How do we bill out that service when it's not a time-based?
So the medical decision making, Dr. House, is that related to the interactive complexity?
It is not. Medical decision making is related to, so for instance, with E&M codes for provider services, physician services, nurse practitioner services, we can choose a range of time, or we can choose a certain medical decision making, like the person had multiple issues, there was labs that reviewed, or we had to
yes.
Right. And so sometimes there is a weird scenario where you might have high level of medical decision making, but it doesn't take you that much time. And so the E&M codes and the range of reimbursement we get from other insurers sort of reflect that. For instance, you might bill out, it's rare, but we might bill out a 99215 for someone that we're getting psychiatrically hospitalized, that's in a crisis, suicidal. We've reviewed labs. They have acute schizophrenia and a trauma and blah, blah, blah. And yet maybe we only spent 15 minutes with them directly. So the med prescriber would then document and code the medical decision-making rather than time. And I'm not understanding how we actually do that in this system where we're only putting minutes.
So I have a couple responses to that, but I see Elizabeth has her hand up. So I'll let you go first, Elizabeth, and then I'll respond as well.
Okay.
Yeah, Dr. House, we had the same question. Our medical director, Dr. Tran, has the same question. And right now the answer is the state has decided to just use those E&M codes based on time. Whether that sticks and stays, because we know that Medicare and all other payers use the E&M CPT codes, like you said, based on medical decision-making or time. But Medi-Cal at this time is using those CPT codes, those E&M codes, just based on time. Because the next question is, if it is based on medical decision-making, what will the documentation be like? Will it follow the specific criteria that you see in the CPT manual or by other payers? None of that is in the Medi-Cal billing manual at this point. Like I said, they've tried to simplify it just a time.
So this creates a real documentation problem for us when it comes down to audit time and things of that sort, because outside of the county, our notes are all designed for that medical decision making, to show the medical decision making. And I think the prescriber is going to really have a hard time with this because time. So, for instance, you could have something that's really intense, really quick, but high level, and so they're going to document that criteria. But then the county or the state is going to down code the reimbursement.
There are, so we actually were talking, as Elizabeth said, Dr. Tran has already brought this up, like, okay, wait,
Yeah.
So we are aware of it as a system. Our medical director is aware. We also met with Cal Mesa yesterday. We've been meeting with them almost every day since implementation to ask questions. And one of the things that can be added, at least for now, I'm going to send out the entire spreadsheet of SmartCare codes. And so Cal Mesa told us yesterday during the meeting that the 3 codes that someone may add as an add-on code, because normally, like we're saying, just put the minutes in and the system will calculate it for you. There are 3 exceptions to that. You would want to add interpretation. So if you're using an interpreter, there's a code for interpreter. There's also interpretation of labs. So that kind of goes with what you're saying, Dr. House. Like maybe we had to look at labs or something in terms of what's happening with the person that you're serving. And then also medical complexity. So there are add-on codes that can be used that I will be sending out today that you can add to your service that you're already providing. So those 3 Cal Mesa already specifically called out. So the labs, it sounds like from your scenario that you're describing, you could use those add-on codes for labs and interactive complexity.
The interactive complexity is I think 90785, and there's very specific requirements. I think I read on one of the questions and answers previously that that would not be reimbursed. I think that was on one of the email chains, that was just an information gathering code. Most insurances do reimburse for that, you know, a small amount, but I thought that would not be reimbursed.
So Jennifer, if you can bring back up the notes, I want to capture this because like I said, Dr. Tran is already very aware and we've been talking about this internally. So if you can,
I mean, we can provide sort of minutes, but I'm concerned with our doc. This is going to be a different challenge for documentation for us, I think, because the CPT code, you know, which is licensed by the AMA, very specific, and their trademark way of doing it. It's going to be challenged to say, well, I did a 99214, but now I'm billing out 10 minutes. And so how do we document that? Can we document that it's 99214 medical decision making, or do we just put the range, or are we having to watch our clock at the same time that we're talking to that suicidal person to make sure that minute is 51% over? Or how's this going to work on the documentation audits?
So Jennifer, please grab Dr. House's question from the transcription, and Dr. House will get back to you on that.
Okay, I appreciate that.
One other point about that, just to add, Dr. House, because again, you know, this is something that we've looked at. Our county operated programs bill other payers as well, and it's a challenge, is that the CPT manual reminds everyone that states can interpret and have billing rules around that might be different for those codes. And we have found that indeed California has done that. So if you look at the Medi-Cal billing manual, it doesn't always jive with the CPT manual. That's the challenge.
Sorry, I was looking in the background at the full code set that I'm going to send out, and the 99214 is listed under procedural code 73. It has 99212, 13, 14, and 15 are all listed under the Cal Mesa procedure code 73. But let's take down the questions so that, because Dr. Tran's asking the same questions too. So
so if I could follow up on that, if we bill out a 99214, or let's say we provide a 99214 level of service, can we just then send to the county, you know, 30 minutes or whatever you all determine is equivalent to that? Or do we actually have to document the time 30 minutes? Or is that what we don't know?
I think, well, you'll be sending it on your CMS 1500 form, correct? So you're going to send I'm showing the full Cal Mesa crosswalk that's going to go out today, which was another piece of information we were going to share anyway. So I'm looking right here at line 74, where it has the procedure code is 73, and then it includes, you know, the 4 codes that we talked about. So you will use the procedure code, and if it was 30 minutes, like you said, or 45 minutes, whatever, you would send it, you know, the procedure code is 73, send in the minutes, and in the background, the system SmartCare will calculate the units that will be submitted. And in terms of the documentation, let me get back to you. Like I said, we've been talking internally. Dr. Tran has brought up some of the same questions. And so we will get back to you.
Thank you.
And we're transcribing, so we'll make sure we get your question exactly off of the transcription so that we can communicate clearly with Dr. Tran what the question is. So the conversation naturally just sort of led into the last piece of information that we wanted to share, which is we will be sending out the full SmartCare procedure code set. What we shared today with you is mostly the codes that you will use and have used in the past. So we created that crosswalk from avatar codes to SmartCare codes. And then we created sort of a mapping guide. Our finance team, Sean and his team, created a way for you to help calculate what is on the amount to put on your code. Kathy showed you how to fill out the CMS forms. We've got the additional thresholds, the minimum thresholds for the codes that you use most frequently. And I did see a question in the chat. If you don't want to calculate and fill out how much is on your 1500 form, you can leave that blank. We just wanted you to be able to determine how much you are going to get paid. And so, you know, if you leave that section on your CMS form blank, that's fine because the system is going to calculate the amount. Are we missing any questions or any hands raised?
There is a hand raised, Matt.
I don't see any questions that we haven't answered yet. And I think, is that Dr. House still with your hand raised? Did you have another question or just need to put your hand down? Well, thank you for bearing with us and staying quite a bit over, 30 minutes over for our training today. We appreciate your time and your attendance. If you have questions about how to fill out your CMS form, email the managed care inbox. If you have general CalAIM CPT coding questions, continue to send those to the DBH compliance inbox as we have all along. So if you need help with the CMS specifically, our managed care team will reach out to you. In terms of all the questions, we will make sure that we capture, validate, get answers to questions, and we will send out this document that'll contain the answers to everybody's questions. So any last comments, questions before we close for today? Victoria, go ahead.
Yes, a quick question. Good morning. I had to reach out to Justin this morning because I did not receive the email, and he explained that it was a different type of coming from different person. So I just want to make sure that he says he was going to email or add me into the list because I didn't receive the info for this meeting today.
Oh, you didn't receive the meeting invitation?
No, and I was like, was there going to be an online training? But anyhow, that's my comment, that it was.
Oh, thank you for letting us know. Thank you for letting us know. No, we intend to have our office hours every other week, so we want to make sure everybody's included. And I'm so sorry that I don't know how we missed you on the meeting invitation, but we will make sure that you have been added to the meetings going forward.
Thank you.
And Tony, I see your hand up.
Yes, are there any upcoming changes with the audits?
Can you speak up just a little bit? We're having a little trouble hearing you.
Yes, any upcoming changes with the audits?
The audit tools have been sent to you. We can send them out again with this communication, but with all of the documentation changes and the assistance from CalMesa, we do have new audit tools. Kathy, I saw you come off mute.
Yeah.
So if you want to address that.
Sure. Tony, to answer your question, if you are scheduled for a compliance medical records review in the coming months, July, August, September, those reviews are actually for the 22-23 fiscal year. So we are looking at services provided prior to July 1st, 2023. So those audits will focus on past claims. As far as the new CalAIM documentation standards, we will be issuing later this summer or early fall our audit guidelines that will apply to the CalAIM documentation standards. So, in other words, we are not going to perform any audits in July and August expecting you to meet these new standards. We are looking only at past claims when you are going to get an audit at this time. And one final note, I did, because I got a couple of messages asking for it. I did put in the chat, you'll see SMHS Billing Manual V1-4. That is the link to the DHCS Billing Manual. And we will also put that in our minutes, and it's also in the PowerPoint, but I went ahead and put it in the chat.
Thank you.
Did that answer your question?
Yes, thank you.
Okay. And then Victoria, can you just for ease, can you put your email in the chat? So anybody's email that's in the chat, Jennifer will make sure that you're added to the ongoing office hours. Because I saw Sarah also needed to be added to the list. So we don't want to miss anybody. So if you know of colleagues that are missing and they missed this meeting, let them know that it's recorded, and we will be extracting and posting it on our website. And we will continue to have office hours and continue to convey information. And there's, lots of things, things that Dr. House brought up, the collateral that we're all still working on in-house to wrap our minds around and figure out how this is supposed to work now. So thank you so much for your questions. That helps us understand what we need to dig into and get answers to. So it's good to have answers when we have them, and it's good to have questions when we don't have answers, so we know what we need to know. So again, thank you so much for your time today, and we will see you in a couple of weeks. Bye, everybody.
Thank you. Bye-bye.
Thank you.